Did you know that sepsis affects an estimated 20 to 30 million people worldwide every year, with mortality rates of 35 to 50%? I am sure at some point in your life you have gotten an infection. It seems simple enough. You go to the doctor, you get a prescription, and the infection, well, it goes away. However, not all infections go away quite so easily. Sepsis is a life-threatening illness caused by your body's response to an infection. Your immune system protects you from many illnesses and infections, but it's also possible for it to go into overdrive in response to an infection. Sepsis develops when chemicals in the immune system release into the bloodstream to fight an infection. However, it causes inflammation throughout the entire body instead. There are 3 stages of sepsis: sepsis, severe sepsis, and septic shock. Severe cases of sepsis can lead to septic shock, which is a medical emergency. Although sepsis is potentially life-threatening, the illnesses range from mild to severe. There is a higher rate of recovery in mild cases. Septic shock has a 50% mortality rate. Although some people have a higher risk of infection, anyone can get sepsis. Sepsis can quickly progress to septic shock and death if it is left untreated. It is important to remember that sepsis is a medical emergency. Every minute and every hour counts, especially since the infection can spread so quickly. There's no one symptom of sepsis, but rather it has a combination of symptoms. From experience, I know that the symptoms can be easily confused with the same symptoms you would associate with the flu. First, it's extremely important to know the main triggers of sepsis. If you have certain infections, you may have more of a chance to develop sepsis. These infections include urinary tract infection, pneumonia, abdominal infections such as appendicitis, infections of the brain or spinal cord, and skin infections. In my case, I had a ruptured ovarian cyst that I was completely unaware of. The major symptoms of sepsis include a fever above 101 degrees or a temperature below 96.8 degrees, a higher heart rate of 90 beats per minute, breathing rate higher than 20 breaths per minute, probable or confirmed infection. Granted, you will have to be diagnosed by a physician, so if you think you have or you do have one of the main triggers and you are exhibiting at least 2 of the symptoms for sepsis, you should go to your physician or to a local emergency room as soon as you possibly can. If a physician does not catch sepsis in time, it will turn into severe sepsis, which is when the infection has seeped into your organs and you begin to have organ failure. These symptoms include patches of discolored skin, decreased urination, changes in mental ability, low platelet count, problems breathing, abnormal heart functions, chills, unconsciousness, and extreme weaknesses. This can lead to septic shock. Septic shock is severe sepsis accompanied by very low blood pressure. Again, the mortality rate once a person reaches this stage is 50%. For years, I have had issues with ovarian cyst. Some of you may know that with women, these ovarian cysts, they come and they go. However, I wasn't quite so lucky and mine would stay, not just go. A few weeks ago, I thought I had another one. I know the signs of them very well. However, I also had back pain, which wasn't normal. And a day later, I had a high fever, which definitely wasn't normal. I went to work. I left early thinking that I had the flu. I called my brother on my way home, and I was talking to him mostly because I needed someone to talk to because I felt like maybe I was going to pass out. So he convinced me that maybe I had appendicitis and not the flu, so I went on to the ER. When I got there, I talked to one of the nurses, and we all kind of thought maybe I did have appendicitis because after they observed my symptoms, I had a fever of 102, my heart rate was through the roof, and my oxygen levels were off, and I had pain. Oh, the pain was tremendous. So they took me straight on back, and at this point, since they thought that I had appendicitis, we went straight on and did a CT scan. However, in the CT scan, they couldn't find my appendix. So then that led them to believe that I had something else going on. So they called in an OBGYN, which just so happened to be my normal doctor, so he sent me off to do an ultrasound. Through the ultrasound, they found a mass. They couldn't tell exactly what it was. He didn't know if it was a cyst or not, but he decided to keep me overnight because from the blood work, he knew that I had an infection. So they started me on some antibiotics. The worst antibiotics I've ever taken. They burned in my veins. They were horrible. With the fluids that they had me on, my fever started going down, and we thought by midnight I was going to be okay. However, when 6 a.m. rolled around, I was in so much pain I couldn't hardly breathe. So when my doctor came in, he decided he was going to do exploratory surgery. So he said, we're not really sure what's going on, so we're going to find out. And I said, okay. So when he did the surgery, he found what he was expecting. I did have, in fact, 2 cysts. One was abscessed and one hadn't burst. It was leaking. And what he found that he was not expecting was I had hit stage 1 of sepsis. There was infection everywhere, and it was trying to seep into my organs at that point. I was on the operating table for over 3 hours trying to flush it out. My doctor enlightened me that had we not caught it in time, I would have very easily gone into severe sepsis. And, I thought I had the flu. I was going to go home and go to sleep. And had I done that, I very well may not be here telling you this story today. In conclusion, sepsis can be extremely dangerous. Knowing the main triggers for the combined symptoms of sepsis will not ensure that you will not be at risk for it. However, you will have the ability to get to the doctor to have yourself checked before it becomes more severe. Risk factors that lead to sepsis can be reduced by many methods. Perhaps the most important way to reduce the chance for sepsis is to first prevent any infections. Vaccines, good hygiene, hand washing, avoid sources of infection are excellent preventative methods. If infection occurs, immediate treatment for any infection before it has a chance to spread into the blood is likely to prevent sepsis. Thank you.